Doctors explain the signs of stroke in women and men. Common signs of stroke in both men and women. One of the easiest ways to remember the primary signs of a stroke is through the acronym FASD, which denotes the following. 1. Face drooping. 2. Arm weakness. 3. Speech difficulty. 4. Time to call emergency services. These signs serve as immediate red flags, indicating that someone might be suffering a stroke. Of course, this necessitates urgent medical attention. Here is a little more information on each letter of the FAST acronym. 1. Face drooping. One side of the face may droop or become numb. A noticeable asymmetry in the person's smile or facial features often indicates a stroke. 2. Arm weakness. Weakness or numbness in one arm, often accompanied by a tingling sensation, is another crucial sign. When asked to raise both arms, one arm may drift downward, highlighting muscle weakness. 3. Speech difficulty. Slurred speech or difficulty in understanding spoken words points to a potential stroke. The individual might struggle to formulate coherent sentences or experience confusion with language. 4. Time to call emergency services. Time is of the essence if you observe any of these symptoms. Immediate action by calling emergency services can be life-saving and significantly reduce the risk of long-term disability. In addition to the FASD symptoms, strokes may manifest through sudden numbness or weakness in the legs, sudden confusion, trouble seeing in one or both of the eyes, severe headache with no known cause, unexplained dizziness, loss of balance, or lack of coordination. Understanding these common signs of stroke forms the basis for recognizing this medical emergency, allowing for rapid response and intervention. However, it's also essential to know how symptoms can vary. However, some are unique to each gender. Signs of stroke in women. Strokes manifest in both traditional common and unique ways between the genders. Women, in particular, may experience symptoms less typically associated with strokes. As a result, it can sometimes lead to delays in diagnosis and treatment. Recognizing these unique signs is crucial for women and those around them. Women may experience several symptoms that are less common in men. These include the following. 1. Sudden face and limb pain. 2. Hiccups. 3. Nausea. 4. General weakness. 5. Chest pain. 6. Shortness of breath. 7. Fainting. 8. Unresponsiveness. 9. Palpitations. Hormonal fluctuations in women, particularly during menstruation, pregnancy, and menopause, can impact the risk of stroke. Birth control pills and hormone replacement therapy. That's especially true in combination with other risk factors, like smoking. Each can elevate the risk of stroke in women. The importance of awareness for women. The CDC warns that strokes are the 5th leading cause of death in American women. Awareness of these unique symptoms is vital as they can sometimes be overlooked or attributed to other conditions. The under-recognition of stroke symptoms in women underscores the importance of education and advocacy to ensure that women and the healthcare professionals who treat them are alert to all potential signs of a stroke. Empowering women with knowledge about these gender-specific signs and encouraging proactive health measures can make a significant difference. Prompt recognition and response to these signs are critical to optimizing outcomes and reducing the impact of stroke on women's lives. Signs of stroke in men. While men and women share several common signs of stroke, understanding the symptoms more prevalent in men is vital. Awareness, timely recognition, and swift action are as crucial for men as they are for women when identifying and responding to a stroke. Men typically exhibit the classic signs, such as face drooping, arm weakness, and speech difficulties. Here are some additional signs that occur frequently in men. 1. Sudden numbness or weakness in the legs. 2. A sudden severe headache. 3. Trouble seeing in one or both eyes. 4. Unexplained dizziness. 5. Loss of balance. 6. A lack of coordination. Certain risk factors are more prevalent in men, contributing to the development of strokes. Lifestyle factors can include smoking and high alcohol consumption. They may also extend to unhealthy eating habits, significantly increasing stroke risk. Furthermore, underlying health conditions like high blood pressure and high cholesterol can contribute to a brain attack. Genetic predisposition also plays a role, making family medical history an essential aspect of individual risk assessment. The role of awareness for men. Encouraging men to be informed, vigilant, and open about discussing these signs is imperative. Education about the main risk factors and symptoms and regular health checkups can help in early detection and prevention. Emphasizing the importance of a healthy, positive lifestyle and addressing modifiable risk factors may reduce the incidence of stroke among men. We can recognize and respond to this medical emergency promptly when we understand the signs of stroke. Knowing these symptoms can save a life. Every 40 seconds, someone in the United States has a stroke, an attack on the human brain. This alarming statistic from the Centers for Disease Control and Prevention underscores the silent yet pervasive threat strokes pose to our health. Stroke can strike like lightning, sudden, shocking, and potentially devastating. Yet, knowledge, awareness, and timely intervention can significantly reduce its impact. Recognizing the signs of a stroke is the key to survival. Understanding the subtle differences in symptoms between men and women can be the linchpin in ensuring rapid response and effective treatment. The aftermath of a stroke can be a journey filled with challenges. However, individuals can overcome and lead fulfilling lives with early intervention, a resilient mindset, and a supportive community. Read on to learn the warning signs in men and women. Both share some symptoms, others are unique. Understanding the types of strokes. A stroke, which advocates may call a brain attack, happens when the blood flow to a section of the brain is interrupted or reduced. That interruption deprives the brain cells of oxygen and nutrients. Within minutes, brain cells begin to die. That's why immediate medical intervention is crucial. There are two main types of stroke, known as ischemic or hemorrhagic. According to research from the American Stroke Association, ischemic events add up to about 87% of all strokes. They result from blocked arteries. However, hemorrhagic events occur due to bleeding within the brain. Causes of strokes. The root causes of brain attacks are multifaceted. They involve an intersection of genetic, environmental, and lifestyle factors. High blood pressure, smoking or tobacco usage, high cholesterol, obesity, and diabetes rank among the leading risk factors. Age, family medical history, and race also play significant roles. For example, African Americans face a higher risk due to the prevalence of high blood pressure and diabetes. While both men and women share these common risk factors, gender-specific risks such as pregnancy, birth control pills, and hormone replacement therapy might each increase the risk in women. Moreover, lifestyle choices like smoking and diet significantly influence risk levels in both genders. Thus, it shows the importance of healthy living in preventing this severe emergency. Impact of strokes. The repercussions of this medical emergency can range from mild to severe. Its effects might last temporarily, or become permanent. The severity largely depends on the location of the stroke in the brain and the amount of tissue affected. Common impairments include paralysis, cognitive deficits, speech difficulties, emotional disturbances, and pain. Early detection and swift treatment are instrumental in minimizing damage and enhancing the chances of recovery. The aftermath of a stroke necessitates a combination of medical treatment, rehabilitation, and lifestyle adjustments. Each survivor's story is unique. But with determination, support, and a positive approach, many can regain independence and enjoy a good quality of life. Recognizing the signs of a stroke is the first line of defense in this battle. Armed with this knowledge, we can act promptly, ensuring that every second counts in the race to preserve brain function and life. Responding to a stroke. Recognizing the signs of a stroke is the first critical step. But you also must know how to respond. What do you do next? Immediate action can significantly impact the outcome. Thus, it may reduce the risk of long-term disability, and potentially save a life. When you observe someone exhibiting signs of a stroke, or if you experience them yourself, follow the FASD protocol we discussed earlier. Call emergency services immediately, even if those symptoms fluctuate or disappear. Every second counts. Indeed, swift medical intervention can prevent further brain damage and complications. While waiting for medical help, keep the person calm and still. Do not administer any medication unless a first responder instructs you. That's important, as the wrong medication could worsen the situation. Medical treatment. Upon arrival at the hospital, emergency department personnel will work rapidly to determine the type of stroke. They'll also decide on the appropriate course of treatment. Interventions to dissolve clots and restore blood flow to the brain are typical for ischemic strokes. In cases of hemorrhagic strokes, surgery might be necessary to control bleeding and reduce pressure in the brain. Post-stroke rehabilitation plays a crucial role in recovery. Therapy programs, tailored to individual needs, focus on regaining lost abilities, adapting to new circumstances, and enhancing quality of life. The rehabilitation process may involve physical, occupational, speech, and recreational therapy. Of course, therapies will depend on the effects of the stroke. Stroke prevention strategies. Preventing a stroke means addressing modifiable risk factors, especially for high-risk people. It also means moving forward in a healthy lifestyle. Lifestyle choices that can help reduce the chances of stroke include these. 1. Regular exercise. 2. A balanced diet. 3. Moderate alcohol consumption. 4. Avoiding smoking. Additionally, managing underlying health conditions like high blood pressure, high cholesterol, and diabetes is essential. Life after stroke, rehabilitation of the brain and body functions. Recovering from a stroke is challenging. This time is also marked by uncertainty and adaptation. The impact of a stroke varies widely among individuals, but the underlying thread that ties every survivor's journey together is the power of resilience, positivity, and support. Rehabilitation is a cornerstone of recovery post-stroke. Rehabilitation programs encompass a range of therapies. They may address restoring function, improving mobility, and enhancing the quality of life. Physical, occupational, speech, and cognitive therapies are often integral components, facilitating the relearning of lost skills and adaptation to new ways of living. Emotional well-being. Addressing the emotional and psychological aspects of recovery is paramount. The journey may bring feelings of frustration, anxiety, and depression. Cultivating a positive mindset, seeking professional mental health support, and leaning on loved ones can significantly aid in overcoming these emotional hurdles. Family, friends, and support groups are crucial in recovery. A robust support system provides a safe space for expression, encouragement, and shared experiences. Connecting with others who have survived this brain attack fosters community and understanding, providing inspiration and hope.